Chairperson and committee members. Thank you for the opportunity to present on behalf of the Australian Association of Medico-Legal Providers. We're an organisation that represents over 60% of the providers in Australia in the medico-legal industry. Our members deliver independent and impartial medical expert assessments within the personal injury system. And these services help injured workers access timely care, support insurers and employers in decision making, and ensure a sustainable workers' compensation scheme that delivers better return to work outcomes for all parties. Our association supports the government's goal of creating a sustainable modern workers' compensation system that better supports workers, especially those with psychological injuries. However, we are concerned that some proposed reforms could cause treatment delays, reduce access to justice, and impact clinical independence. It is vital that any reform prioritises early access to care and fair independent assessments. When these principles are upheld, workers recover faster and the system benefits through lower long-term costs and reduced premium pressures for employers and the government. There's 3 points that we wanted to emphasise. The first one is the importance of early engagement and return to work planning. So within the first 21 days of a valid claim, workers must have access to qualified independent mental health experts, working closely with their treating GP. This collaboration ensures a clear diagnosis, coordinated treatment and informed liability decisions. Independent mental health professionals bring specialised expertise in accurately diagnosing genuine psychological injuries, ensuring liability decisions are made promptly and based on sound clinical evidence. This prevents workers without true workplace-related psychological injury from remaining in the system unnecessarily, while ensuring that those with legitimate injuries receive early targeted care. Early expert input also importantly determines whether a worker should return to their employer or transition to a new workplace for better recovery. The current scheme strongly encourages returning to the same employer, but for many psychological injury cases, this can prolong recovery and lead to disputes. Our second point that we'd like to raise is concerns with Part 6 of the bill, permanent impairment assessments. Part 6 would introduce a centrally controlled process for impairment assessments, requiring workers to obtain legal advice before an assessment and limiting both workers and insurers to authority-approved assessors. This approach could impact clinical independence and raise concerns about the authority's dual role in managing the scheme and controlling access to experts. It may also limit access for workers and insurers to seek their own independent expert opinions, which are often important in resolving complex and contested claims. Courts and tribunals already have the structure and expertise to manage these disputes and assess conflicting medical evidence. So we believe the existing dispute resolution system should remain the primary pathway for resolving medical disagreements. We recommend that no changes proceed until the impact of new impairment thresholds is clear. Combining restricted access to the independent opinions with higher thresholds risks limiting access to justice and fair compensation for genuinely injured workers. The current approach should be maintained until there is clear evidence that further reforms are both necessary and will not create additional barriers. And our final point, legislating the role of other expert assessors. Currently in the New South Wales legislation, it requires that a medical doctor, such as a GP or a psychiatrist, must diagnose psychological injuries for the purposes of workers' compensation claims. However, due to high demand, accessing psychiatrists for independent assessments can involve lengthy wait times, often extending several months despite their best efforts to meet the demand. These delays can postpone liability decisions, delay treatment, and ultimately prolong an injured worker's time away from work. To address these challenges, we propose amending the legislation to allow appropriately trained clinical and neuropsychologists to diagnose psychological injuries and contribute to liability decisions alongside medical doctors. Trained nurse practitioners and occupational physicians also should be considered, we believe, giving their understanding of workplace environments and demands, which helps them tailor practical recovery plans. Expanding the pool of qualified assessors would improve access, cut delays, and allow treatment to begin sooner. while enabling specialists to address workplace and psychosocial factors so injured workers can return to function faster, achieve sustainable employment, and reduce the risk of long-term disability or relapse. Just in summary, early expert engagement with GP collaboration, quick return to work planning, and access to qualified assessors is essential for timely care, accurate decisions, and better outcomes. And we believe these steps will support workers, reduce delays, and contain costs for insurers and employers, creating a more sustainable and balanced compensation scheme, while ensuring workers and insurers can still access truly independent medical opinions to keep the system fair and transparent. Thank you.